Physical therapy is an amazing career. I'm a physical therapist and I absolutely love what I do, and I love going to work every single day. I love that I can make an impact on people's lives. I love that I have a holistic approach to help people improve and get better physically, mentally, and emotionally. And I'm autonomous in what I can do. I don't have somebody watching over me and telling me what I can and cannot do. I make decisions. In this video, we're gonna talk all about career changing towards physical therapy, what it's all about, and some of the different specialties in physical therapy, and some you might not know about, and really some ways to make some extra cha-ching. So we're gonna get into all of that in this video right now. Let's go. Lego. What's up everyone? My name is Dr. Justin Lee, physical therapist. I'm the PT admission expert and I help students get accepted into physical therapy school the first time. So in this video, I want to talk about the top 6 things that really influenced me to become a physical therapist in the past, and also still things that keep me in the world of physical therapy today. And the first one is talking about the different specialties and the different niches that you can get into and how it helps you make some extra money. So in physical therapy, you can actually get a specialist degree or a specialist certification per se in these different fields, but doesn't mean that physical therapy is limited to those things. Now, the things that are more recognized in the world of academia in physical therapy, and these are the certifications you can get in PT. First one is cardiovascular and pulmonary clinical specialist. You have geriatric clinical specialist, orthopedic clinical specialist, neurology clinical specialist, pediatric clinical specialist, oncology specialist, women's health specialist or pelvic floor specialist now, electrophysiologic clinical specialist, sports clinical specialist, and wound management specialist. Now, these are top 10 niches that you can get certified in the world of physical therapy that are academically recognized, but that doesn't mean that you have to have a specialist degree to have a specific niche. For example, technically, you don't need a sports clinical specialist certification in order for you to be a sports specialist in a specific field. You can totally be a basketball sports specialist, an ACL sports specialist, a volleyball, a softball, a swimming, a golf sports specialist. Technically, you don't have to have this certification, but it definitely helps you become more reputable and recognized as the authority in the field. So you can actually rise faster if you have those specializations, but you don't have to have these specialists at all. For example, women's health or pregnancy, postpartum, right? You don't have to have this specialist degree in order for you to be a specialist or be the authority figure in that field. You can just go straight into it, but obviously you need to have a little bit of education and background in that field, and some testimonials and some written responses and some reputable proof that you actually help this type of field. Now check this out. In today's day and age, in this social media world, as long as you can showcase that you can help these people, this specific niche population, you can charge some extra money for that and do that on the side while you're also doing your physical therapy job. Your physical therapy job, 40 hours, you might make like, let's say $30, $40, $50 an hour, but in your specialist job that you might have just a select handful of folks, you can charge up to hundreds with a S, hundreds of dollars per session if you are the go-to guy or gal for that specific niche. Niche. Riches are in the niches, all right? Wow. Why I love physical therapy? Man, there is so much opportunity. In addition to all of that, if you decide, hey, I got into sports, but sports is a little bit too much of a headache. I have to travel with them, I have to do all this, it's a lot of pressure. I want to just switch over to pediatrics and work with kiddos. You can totally do that. Your license can shift over. You just gotta re-educate yourself, But in physical therapy, when you have your license, you have a generalist license, so you can get into sports at one point, and then you want to go into pediatrics at another point, you want to go into neurology at another point. You can do any of that at any time. Okay, number 2, physical therapy has a holistic approach. That means it's not just the physical, but also the mental, the emotional, the psychological, the spiritual, and also nutrition as well. And we use an approach that does not use surgery, injections, or pills. Now, depending on the stage, yeah, sure, you can inject them with dry needling and all that stuff, or use some medication, but very, very minimal. We are called conservative care for a reason, right? People go to us because they want to avoid surgery, use any kind of injections, or get into medication. So physical therapy, and I love that approach because physical therapy can help improve people's quality of lives without going down a route where there is no turning back. Once you get cut for a surgery, you will always have that cut forever. There's no going back with that. With physical therapy, you can try strengthening and getting stronger. If that doesn't work, it's not like, you know, you getting weaker is a backwards step, right? No harm, no foul, at least you tried. Now, I just want to say as a disclaimer, physical therapy isn't the cure-all. This holistic approach isn't a cure-all. There's a time and place for surgery, injections, medications, where it really could enhance and has taken our world of medicine really far in this world. But I don't think that's the answer right away. I really think if people can get stronger, if people can move better, if people can have the habits that are put into place every single day to sleep better, eat better, all those different things, and manage your stress, I think a lot of the pains and aches that are felt in today's world can be managed through physical therapy and exercise, fitness, instead of surgery, injections, and pills. And number 3, being an introvert and an extrovert, and I want to talk about this for a little bit. When you're in physical therapy, you are going to have to talk to people. One-on-one or several people at a time, maybe even give some seminars or some workshops and have some group public speaking skills, right? Now, a lot of people think you have to be an extrovert in order to fit your job as a physical therapist because you're talking to people all the time. No, not true. Introverts do an excellent job at becoming physical therapists. But I do have to say, I mean, extroverts and introverts still talk to people, but the difference is that extroverts get energy and their battery gets recharged when they're around people all the time. Do you have some friends where you can think of where they're like, man, they just get a boost of energy all the freaking time? And then there are introverts who can talk to people, but as they're talking to people, their battery starts to drain little by little. And at the end of the day, they are talked out. Now, before you draw to some conclusions, you can be both. A little bit of extrovert and introvert. You're not gonna, you don't have to be labeled as one or the other and put in a box. Now for me, as you may think that I am an extroverted type of guy, because we're doing all these YouTube videos, but really, am I talking to anyone while we're filming this? No, there is nobody here. I'm literally talking to a camera who does not talk to me back, but we are best friends. I'm actually pretty introverted. I know how to public speak and talk to a crowd, but at the end of the day, when I come home, I'm drained. And all I want to do is just have some peace and quiet. And my wife even knows this, where it's like, you know, Justin comes home, I'm just let him like chill and kind of decompress a little bit before I bombard him with some questions like, how's your day? How's this? How's this? All that kind of stuff. I just need a moment to breathe and rejuvenate. That's why if you have shadowed some folks and you're shadowed some physical therapists in the clinic, physical therapists like to eat alone because a lot of physical therapists are introverts. And yeah, they just don't want to talk to people. They're talking to people all day, right? So if a PT has goes into their room, don't judge them, don't think they're a loser. If a PT kind of leaves to eat in the car or whatever, totally normal, right? PTs just, they talk to people all the time, so they just want to chill out by themselves. All right, number 4, this is something that was huge for me when I got into physical therapy. I was really interested in it, and when I started working as it ignited my fire as to why I want to be a physical therapist even more. So physical therapy has a really great opportunity to make an impact. And now impact, what I mean by that more specifically, is that when you personally do the work, you can see the fruits of your labor right away. Like literally, because of my decision of helping you with these types of treatments, originally when you had pain to your knee while you were walking, now because I did these treatments, you don't have pain while you're walking anymore. Literally on that same treatment, on the same day, just a few minutes later after I do a treatment. We do this thing called a pre-test, post-test. Pre-test, you check their walking, ow, my knee hurts. You do some exercise, you do some mobilization, some manual therapy on it. You have them walk again, and you retest, post-test on if your treatment was better. Literally something where a person is coming in where they had pain for years can come in and I can see them, or a physical therapist can see them, and after one session can make a dramatic and significant difference from that same day. Now imagine doing that 1 session, 2 sessions, twice a week, 3 times a week, several weeks, how much of a positive and influential impact you can make on somebody's life. You could probably relate to this. You had back pain, knee pain, foot pain, neck pain, whatever kinds of pain, and maybe for a couple years actually. Is that pain limiting you from doing a lot of the things that you love to do? Well, what if you can see someone, a physical therapist, and that person can help you decrease your pain and get rid of your pain? What kind of influence, how would that change your quality of life? How would that change the things that you would love to do but said, I can't do that because my back hurts? Wouldn't it be good to play basketball again? To stay active again? And do all these great things? Physical therapy does that, and what I love about it is that you can see literally a direct change right away. This is so different from a lot of the different occupations out there in the medical world. For example, doctors, nurses, because they administer medication and then you don't see the journey, and then you do a follow-up and you're like, oh hey, that was great, yeah, you got better from some of the medications that I gave you, or things like that. But the journey is what is the sweetest part of anybody's life. That's why people love being coaches. Because being a coach, you get to see them from where they're at, you have an influence in their life, and they get to a certain result. Man. So, you're making that direct impact every single day, every single session is huge. And that's one of the biggest things why I love being a physical therapist. Okay, number 5, the patient-centered approach. Woo! The patient-centered approach means that you are not looking at their diagnosis and you're treating them around their diagnosis. For example, someone might have patellar tendonitis and you're not saying, okay, patellar tendonitis, this is the way you treat it and that's it. That's how doctors treat. They have a diagnosis and they treat around that. They know everything about that diagnosis and they're gonna give you every single medication that can be helpful for that. But a patient-centered approach is different because somebody might have patellar tendonitis, but they are a basketball player who is a, let's say he's a male, a dad, and somebody who is active on the weekends. So now everything of your treatment is related with the patellar tendonitis in mind, but it's revolving around this person being a dad, a basketball player, and being active on the weekends. So you have to decide which treatments are gonna be most appropriate to make it realistic for this person to do. Are you gonna give them exercises, a bunch of exercises? Because I can give you a bajillion different exercises. But as a dad, do you have time to do that? As a basketball player, am I gonna have you just do like clams and bridges all day? No, I'm not. So this patient-centered approach, it's really cool, and the cool thing about being a PT is that you're able to look at the lens of the whole person. And I think that's how we should approach relationships and people in our lives, not just a facade of their profile and thinking, okay, this is who they are and I size them up. No, you look into that person and you think about their lives, what makes them tick, what makes them feel loved, what makes them feel valued and important. And those are the things and those exercises, and you make those decisions for that person. That's what you do for physical therapy. And the cool thing about PT too is that you have the authority to refer this person to somebody else if they need that, right? If they need an MRI, if they need to see a neurologist, you can make the decision to refer them to their neurologist or their primary care doctor to say, hey, we need an MRI, or you need to look at their brain or whatever it is, because I think that they need a little bit more help in that direction. You'll learn about all of that in PT school, and you have the authority and you make that decision to say, I'm gonna take you here, here, or we're gonna stay in PT. You are the man, you are the woman to make that decision. Okay, lastly, and this is something I really love about PT, is the hands-on aspect, the manual therapy, the different types of techniques and strategies that you can learn to manipulate tissue to make such a unique impact on somebody. Think about your job, or think about many jobs in the world, whether that's a teacher, engineer, all that kinds of stuff. In the most professional way, can they touch people? Like, is that really a part of their job? Answer is probably no. They probably don't touch people at all. Physical therapists are one of the most unique jobs out there, very few, where they actually can touch people as a part of their jobs in a professional way, right? In a therapeutic way, in a healing way. You come in with back pain or neck pain, I'm working on your back and neck to make sure that I'm using non-verbal communication to tell you and your body that I got you, that your body is safe, and that we are promoting healing as soon as I lay my hands on you. And I love that so much, because I don't know what you believe in, but I'm a Christian. And everything that I read about Jesus and everything that he does to heal people, he's putting his hands on them, or he's verbally saying some things. To me, that is huge. And as a disciple and follower of Christ, that is what I want to do and just represent every single day of my life. So you have a career change, or you want to do a career change, you want to think about physical therapy. I feel like I talk my heart out here. These are the top 6 things that really drew me to PT and keeps me here today. These are the things, it took me a long time to reflect on these things. These are the things that are keeping me from working as a physical therapist today, tomorrow, that gets me up and makes me feel excited about the job that I'm doing. And the coolest part about all of this is that I'm in control. I make the decisions. I can have the impact. And I know it's not about me, but I mean, my mental well-being, my mental health, and my overall well-being is important. And how it makes me feel is a big part of that. And the things that I shared with you today make me feel grateful, make me feel abundant in my love to give. It makes me feel just absolutely appreciative of life and just makes me feel like I'm making an impact to folks and the people that I encounter every single day. Hey y'all, I don't know if you watched to the end here, but if you did, and if this video was impactful, and I'd love to hear how it was impactful to you. I really love to hear in the comments. Did it sway some decisions? Did it influence you in some way, shape, or form? Or maybe you're like, I didn't know physical therapy was such a this type of world. I don't want to do it. I'm genuinely curious. Please let me know in the comments. And again, if you like this video and appreciated the things that I said, please give this a like and share this with some of your friends, maybe some PTs or your colleagues or some other students that are interested in the PT world. Every day is a great day to be a physical therapist, and I hope that this video inspired you to become one as well. I'll see you in the next video. Have a great one, you guys.